April 2024. 1 billion packs of generic dolutegravir, DTG, have been supplied through Medicines Patent Pool and generic manufacturers.
Right now, the stigma is not very high like before. The people are educated about HIV and AIDS at school, in hospitals, in churches, so people are aware. I have HIV and I can manage it, I can do my works, I can raise my kids, so it's not a big challenge. It's a challenge, but not very big like before. Before, even if you sitting on a chair like this, somebody can't sit there because you are sick. Even if you use a cup, if you use a spoon, they say, this lady is going to die, so we don't need to share things with her. But nowadays, people are educated and they know this is just HIV and you can manage to live with it. When I give birth to Mercy, is when I know my status. Up to now, when Mercy was little like 1 year and a half, Mercy was really sick, very sick. By that time, she has TB, HIV, and it was rough and tough. We were in a center somewhere. The sister asked me, Mama Mercy, when Mercy died, where would you like Mercy to be buried? I did not answer her. I just feel get myself crying. So it was not easy. Right now I can see the girls they are big girls, big mamas.
Beautiful ladies.
So if I say HIV is nothing, if you can manage it and stay with all those years when I'm HIV, I'm still strong, I'm happy, and I want to maintain it. To be beautiful, even I don't want to be older. I thank God because how far she brought me up to now is God's mercy. I thank God. I pray and God wake me up alive every day. So I'm happy. Yeah. But right now we don't have.
The story started a decade ago, in August 2013, when DTG was approved by the FDA.
La situation de l'épidémie au Sénégal est de type concentré. Nous disons que c'est une épidémie de type concentré parce que l'épidémie est faible dans la population de façon générale, de façon globale. Actuellement, avec le dernier spectrum de l'ONU-SIDA, le taux de prévalence au niveau national est de 0,3%. Par contre, cette épidémie cache de très grandes disparités, des disparités au niveau des populations que nous appelons les populations clés.
bu ma koy am nag amoon naa problème ndax demoon naa ko ci sama kii bi demoon naa sax ba bugg a xaru ma dem hôpital ñu ne ma après dinañ la xel di jox garab boo xam ne day calme sa kii bi te kenn du ko xam noonu laa def nag ma bàyyi.
Avec l'avènement du dolutegravir, on s'est rendu compte que vraiment le traitement au VIH au Sénégal a été révolutionné. En quoi? Les gens sont mieux portants, ils sont mieux adhérents au traitement, mais également certains ont pris du poids. Et pour nous, prendre du poids est synonyme de bonne santé. Et ça, le dolutegravir l'a apporté. C'est pourquoi aujourd'hui, les médicaments optimisés, les nouvelles molécules sont importantes pour des pays en voie de développement. Parce que ça permet de renforcer cette adhérence au traitement. Ça permet de réduire le nombre de pertes de vie, le nombre d'arrêts, de ruptures de traitement qu'on rencontrait auparavant. Donc, il est essentiel que Medicines Patent Pool continue vraiment à à négocier avec les firmes pharmaceutiques ces licences de ces nouvelles molécules pour que les pays en voie de développement puissent y accéder très rapidement. On sait qu'aujourd'hui, si on veut vraiment atteindre la fin de l'épidémie d'ici 2030, il faut qu'on mette le paquet sur les pays comme les continents comme l'Afrique, où on a le plus grand nombre de personnes vivant avec le VIH. Et pour ça, il faut des médicaments vraiment optimisés. Il faut des médicaments efficaces qui traitent très rapidement le VIH, qui suppriment très rapidement la charge virale. Parce que si la charge virale est supprimée, la transmission du VIH est quasiment réduite.
Depuis l'avènement vraiment du dolutegravir, non seulement il y a une amélioration par rapport aux effets secondaires, mais aussi il y a une amélioration surtout aussi à la prise en charge par rapport aussi au suivi surtout des malades, mais maintenant surtout aussi par rapport aussi au contrôle par rapport à la charge virale qui a fait aussi vraiment une chute drastique surtout de la charge virale chez certains patients. Et donc les patients vraiment se sentent mieux avec le dolutegravir. Ce qui fait qu'actuellement pratiquement l'ensemble de nos malades, 99% sont sous dolutegravir.
deux mille seize la judd bu mu juddee ci xam nga boobu man kii ci ëmb bi xaw ma woon ne ci la commencé wu ma woon naan xam naa foofu la ko jëlee après bu mu ko wasine ñu xool ko ne dafa am ñu koy jël maa koy jëlal ay garab moom tamit mooy sase yi am kii dañ ko doon xotti fu ndax la woon dañ ko doon seyal waaye yenn saay boo ko joxoon da koy bañ a naan ba demoon na sax ba feebar ci garab bi si gis naa ci changement kay ndax moom léegi dafa changé da koy naan normal tamit boo ko joxee da koy wën noonu te moom dafa changé léegi dafa am yaram sax.
Maintenant, avec l'avènement aussi du dolutegravir 10 mg, ça a beaucoup vraiment contribué parce que aussi c'est des molécules qui vraiment aussi, les conditions où on doit le mettre, ce n'est pas des conditions compliquées. Et on peut le vraiment aussi garder au niveau des zones les plus reculées où il n'y a même pas d'électricité. Donc ça contribue vraiment beaucoup, surtout par rapport à la prise en charge des enfants.
Aujourd'hui, l'avènement du dolutegravir, avec le goût qui a changé, c'est les enfants dans cette molécule-là. Aujourd'hui, les enfants sont beaucoup plus adhérents à prendre ce traitement-là. On a vu que la plupart ici dans la région de Fatick, plus de 80, je dirais même 90% des enfants maintenant qui sont sous dolutegravir pédiatrique ont une charge virale indétectable. Et ça, c'est une révolution. C'est top.
In April 2014, Medicines Patent Pool signed a voluntary license with ViiV Healthcare. The license allows generic manufacturers to supply DTG standalone and combination regimens in countries that are home to 94% of adults and 99% of children living with HIV in low and middle income countries.
For many years, because the epidemic was in women, the main approach was all focused. Everybody's money, everybody's attention were going to women. And then I think it became quite obvious that there was a whole group of people that were missing in the conversation. And you can't talk about young women without talking about young men or about the people that are infecting them.
My name is Lusanda. I'm 42 years old, one child. It was 2017. It was after July when I was sick. Then I went there, and there's a clinic there in the side. They told me I've got TB at that time. Then I tested for HIV. That's where I knew at that time.
Women can't really get away from the health system because they will often come for contraception or they come when they're pregnant. Men, on the other hand, do not ever engage with the health system unless they have an STI. And we find at our site, that's the access point for men into our services is when they have an STI. So that's the starting point.
I spent 4 weeks there in DTG hospital. 4 weeks. Because when I went there, I collapsed there. So they took me there, put me in the room, treat me. Then they will give me almost every medicine they were giving me. I was not sure which medicine I was taking at that time. And then after 6 months, then I started my treatment.
You tend to have to focus on the men who are slightly older because, so it's young women between the ages of 18 and 24 that are becoming infected. The peak age of infection for men is about 32.
Most of the men, they will never talk about HIV, just like me. It's the first time now I'm talking about this. It's only my family that knows that I'm HIV positive. Most of the people here in Cape Town, they've got it, but they will never go there to the clinic. They are afraid. I was afraid also. But when I became sick, it was not nice at that time. It was a must to go there.
It's almost like the women are behaving responsibly and the men are all out doing their own thing because you can't get men onto treatment. So women, at least they're diagnosed, they're put onto treatment, they're usually quite adherent. That's that problem kind of sorted. But men, love you guys.
There's a class there in Nomzamo where they tell you how to take your medication. Then I learned something there. So I'm taking my medication right.
If you want to speak to men, you have to be a little bit more creative around going to places where men play sport. So soccer tournaments, churches, concerts, those kind of places.
That nurse told us something. There's a 3 bottles they are giving us. It's a viral load, something like that. I forgot those names, man. But there are 3 bottles there they're telling about. If it's black, you must know that we are right. But if it's middle, your soldiers are fighting. But if it's red, all of it is red. Oh, there you go.
When people hear messages from different places, it lands differently. So a nurse in a clinic, the message might not land as well as a celebrity who's telling them about something. So I think it's having different messages, but then also having that health provider there that can clarify or answer questions.
Don't say, no, I'm stopping. You're going to go back to that red bottle again. That's what I'm saying. She's going to tell you one thing every day. Every month you go there. Did you bring a bottle of water? Yeah, it's my bag. Oh, so you are listening. Yeah. Good. And it's all right, man.
The global health community, Unitaid, UNAIDS, WHO, EGPAF, CHAI, and many others, NGOs, communities, civil society, faith-based organizations, local and international, made sure that DTG was suitable for all.
வணக்கம், என் பேர் இலக்கியா. நான் வட சென்னையில் இருக்கிறேன். நான் வந்து ஹெச்ஐவியால் பாதிக்கப்பட்ட ஒரு திருநங்கை. நான் வந்து எனக்கு ஒரு 17 வயசு இருக்கும். நான் எங்கள் வீட்டில் சொன்னேன், எனக்கு இப்படி இருக்க தோணுதுமா, எனக்கு லேடிஸ் ட்ரெஸ் போடணும் தான் ஆசையாக இருக்குது, எனக்கு ஆம்பளை துணி போட பிடிக்கலம்மா, எனக்குள்ளேயே ஏன் இப்படி இருக்குன்னு எனக்கு தெரிலம்மா, எனக்கு இப்படி இருக்கதாம்மா பிடிச்சிருக்கு அப்படின்னு எங்கள் வீட்டில் சொல்லி பார்த்தேன். அவங்க புரிஞ்சுக்கிற மாதிரியே இல்லை.
So the main vulnerability the transgender community faces, safety and security. The minute parents don't accept them, they have to walk out of the house. Once they walk out of the house, they come into the society. The society look at them like another alien person, and they don't know how to deal with them. And these people also expect love and care from them, which definitely they will not get.
நான் வந்து எங்கள் ஊரில் என்னை பெற்றவங்க ஊரில் இருக்கும்போது எங்கே வேணாலும் போவேன், யார் கூப்பிட்டாலும். அப்போ வந்து எனக்கு வந்து நிறைய ஆசைகளாக இருந்துச்சு. இப்படிலாம் இருக்கணும், ஒரு பையனை பார்த்தா அப்படிலாம் இருக்கணும், அப்படிலாம் ரொம்ப ஆசையாக இருந்துச்சு எல்லாம்.
Once they want to work, the employment becomes a problem for them because they are transgender community, and because they don't get the jobs, there is no income for them. Fortunately or unfortunately, they have to go for begging and sex work, which bring them some money, which they can buy the food, and they find the shelter in their own community. Because health wise they are having unsafe sex, they are into HIV and AIDS. This becomes a major problem for most of the transgenders because many of them are infected and affected with HIV and AIDS.
அதுக்கப்புறம் எனக்கு ரொம்ப உடம்பு சரியில்லாமல், ரொம்ப ஒரு மாதிரி ஃபீவரு, ஜுரம், கை கால் முடியாமல் வலிக்கிறது, கால் வலிக்கிறது, தலை வலிக்கிறது, எல்லாமே ஒரு மாதிரி இருந்ததால் அந்த டைமில் சகோதரனில் வந்து கேம்ப் வச்சாங்க, HIV, அதாவது அவங்கள தெரிஞ்சுக்கிற மாதிரி கேம்ப் வச்சாங்க. அப்போ நான் போய் அதில் கலந்துக்கின்னு அதில் செக்கப் போனேன். அப்புறம் எனக்கு செக்கப் கொடுத்துட்டு நான் போயிட்டேன். எனக்கு ரிசல்ட் அதாவது எனக்கு ஒரு மாதிரி எதுவுமே தோணவே இல்லை. சரி எதுவுமே இருக்காதுன்னு சொல்லிட்டு நானும் கொடுத்துட்டு வீட்டுக்கு போயிட்டேன். அப்புறம் 2 நாள் கழிச்சு ஃபோன் வருது, வா இங்கே வா. அது என்கிட்ட சொல்லவே இல்லை இங்கே இருக்கவங்க யாருமே, கஷ்டப்படாத நாங்களாம் இருக்கிறவங்க கூட அப்படின்னாங்க. அப்போ நான் ரொம்ப அழுதேன், எனக்குள்ள மனசு கஷ்டமாக இருந்துச்சு.
The minute you know HIV positive, there is a fear among other people, like deviating from them, distancing from them, and many of them are not given houses here, and the use of toilets and the use of syringe, everything becomes a problem.
எனக்குள்ள மனசு கஷ்டமாக இருந்துச்சு. இறந்துடலாம், ஏன் இந்தமாரிலாம் இருக்கிறோம் நம்ம. ஏடி வந்து நான் 2.5 வருஷமாக எடுக்கிறேன். சரி என்ன பண்ணுறது, சாதிக்கலாம் எல்லாத்தையும் சொல்லிட்டு பண்ணுறேன்.
This is a drop-in center of Sacred Heart community for people living with HIV/AIDS, people living with tuberculosis, and anyone in crisis. When a person is identified, that's the time we find that the person is so badly affected. They feel that their whole world is collapsed. There is no sense of hope. They are good for nothing. They have no future. That's the time to be with them, give them a kind of message that we are there. Even if everybody else may ill-treat them or may not accept them, then as days go by, the person feels a little bit okay, confident, able to go to the hospital, visit the ART center, meet the doctor to share about the challenges. Now I can say our ART center is the best, where the medical officer and the other staff give the best care for people living with HIV.
6 வருஷமாக ஆகுது. 3 மாதங்களுக்கு முன்னாடி நாங்கள் TLD மாத்திரை எடுக்க ஆரம்பிச்சிருக்கோம். அந்த மாத்திரை எடுத்ததுலேருந்து என் உடம்பு ஒரு நல்லா இருக்குது, சுகமாகவே இருக்குது. சைடு எஃபெக்ட் எதுவுமே அந்த எதுவுமே இல்லை. ஒரு மாதத்துக்கு ஒரு முறை நான் ART சென்டருக்கு போனோம். அது போகும்போது எனக்கு வேலைக்கு லீவு கொடுக்க மாட்டுறாங்க. அதனால் எனக்கு போகிறதுக்கு வரத்துக்கு ரொம்ப கஷ்டமாக இருக்குது.
Whatever resistance is there, we roll with their resistance, and slowly they learn, okay, these people are there to help us, we can trust them, and a kind of confidence is built. We try to give them mental immunity boosters. Like the medicine works for physical immunity, they also need mental immunity. So we give them exercises, make them laugh, dance, all kinds of things possible.
வந்து எனக்கு வருஷத்துக்கு மாதத்துக்கு எங்களை கூப்பிட்டு அவங்க நலத்திட்டம்லாம் கொஞ்சம் பண்ணுறாங்க. எங்களுக்கு இது கஷ்டம் வரும்போது எங்களுக்கு சூரிய பிரபா மேடம் வந்து கூப்பிட்டு எங்களுக்கு கவுன்சிலிங் கொடுக்குறாங்க. கவுன்சிலிங் கொடுத்து இந்த மாத்திரை கண்டிப்பாக போடணும், நீ போடாமல் இருந்தாலும் உடம்புக்கு கேடு, சூரிய பிரபா மேடம்.
DTG is part of the WHO recommended treatment for first and second line treatment for all populations. Today, over 90% of people on ARV treatment in licensed countries are estimated to be on DTG-based regimens.
When I gave birth to her, I just gave birth in the house. I didn't go even to the hospital. So I didn't know whether I was HIV positive or not. She was very healthy until 7 years old. She started to be sick, but I didn't know what was going on her. I went to the hospital. There's a friend of mine told me, Anna, you just go and know your status. If you know your status, it could be better because your kids are still young. So I take action. I went to VCT. I know my status. My mom came from up country. She told me, Anna, because you are sick, I want to take this your children's. This my young daughter with my elder son. I'm going with them up country because you are now weak. You can't do even your business. I was calling my mom, how is my daughter? My mom still telling me, hey, your daughter is sick every now and then, carrying her to the hospital. So one day I just decided maybe this child could be sick. I took her to their daughter. They tested her and they found her she's HIV positive. Thereafter, I started medication for her.
Actually, I never knew why I was taking medicine. My mom used to tell me, you just have to take this medicine because you have a chest problem. So I lived with that idea until I was class 5. And there was this boy who used to bring the sister there. I never knew anything about HIV. So the boy one day shouted to the class that Nancy has HIV. I was surprised too, so I had to burst in tears. I came and told my mom and she was like, so what if they know? You're okay, don't show that you have HIV. It's not written here that you have HIV. You can live. So, she was trying to encourage me. For our parents, it's very difficult to tell your child that you have HIV, especially if that child was born with HIV. It's a very tough thing for a parent. So she just kept on encouraging me. That's when I realized I was HIV positive. And she ensured that I was taking my medication on the right time. I didn't miss. I have been undetectable for over 10 years, actually, thanks to her. It's very hard to take medicine every day. As a child, maybe it will be hard because you have a guardian there who will be supervising you. But as an adult now, sometimes you're just exhausted every day. There's no feel burden, actually. There's that mentality that I want to skip today. I'm just tired. Let me take a break. That's how I usually feel. I'm actually struggling with the adherence at my age right now.
My daughter, I'm so happy for her. She's very active. She knows what she wants. She's a big woman now. Me, I'm okay with her. Yeah, I'm very happy for her.
Around 24 million people take generic DTG on a daily basis, most in the form of TLD, tenofovir, lamivudine, dolutegravir. TLD is a 1 pill a day fixed dose combination and by far the most widely used HIV treatment in the world.
My name is Hari Singh. I am living with HIV past 30 years. I was diagnosed in 1994. Now I am working as a OST counselor at Chandni Chowk Kotwali police station. Reason is that a lot of snatching and crime injecting drug users and the other criminal people are doing very small crimes they are doing for their drugs and for their purchase of injection and like heroin. We will meet the DCP and what can we do for you? This area is very crowded. So many people are here taking injections. People share the needles to others using used syringes given to others. So this area is very high risk area. And after the meeting with Deputy Commissioner of Police, we decide we will provide the treatment. It's a very amazing program. Patient come to our center and take the medicine. It's a sublingual medicine, OST, opioid substitute therapy, buprenorphine medicine. This will provide by government of India, like from NACO, given us, and we will distribute in the patients daily. I counsel them and family counseling of them, find out their problems, personal problems, livelihood problems, and the treatment problems. I will send for HIV testing and Hep C testing, hepatitis B and C, and for screening. If they found HIV positive, I will send them to the ICTC center. If they again found confirmed at ICTC HIV positive in Hep C or HIV, I will send them to the ART center and link to the PLHIV network. I think we are about to, last 8 years we are here. The crime is definitely reduced. If someone not come time to time daily at our center like lost of follow-up, I take the help of outreach workers and peer educators. We too also go to the hotspot and to their residence. Some people are completely recovered from this drug addiction. They are completely recovered and they are thankful to us.
In low and middle income countries, the global fund price for TLD is under $45 per patient per year.
Très bien. Madame. Bonsoir, bonsoir, ma soeur. Bonsoir, madame. Bonsoir, ma soeur.
Moi, c'est Madame Mengagat. Je vis à l'est du Cameroun. Je suis porteuse du VIH, du séropositif. Depuis 2007, donc à compter de 2007 jusqu'au jour d'aujourd'hui, ça fait déjà 17 ans. Au départ, j'étais bien galvanisée. Je prenais bien mon traitement. J'ai bien pris pendant 8 ans. Et à un moment donné de la vie, je me suis dit, ah, je suis déjà bien portante, ça ne sert plus à rien de continuer de prendre le traitement. J'ai résisté pendant 4 ans encore, sans toutefois savoir qu'à l'intérieur de moi, j'étais en train d'être rongée petit à petit. Je viens dans ce centre parce que quand je chute, on me réfère ici. Dans mon ancien centre, on me rejette. On me dit, ah, vous êtes comme ça, vous partez, vous jouez avec les médicaments, vous les prenez, pas vous voulez qu'on vous reprenne. Il y a un centre de santé, DREAM, une structure catholique. C'est comme ça que quand j'arrive, à l'époque, il y avait la sœur Anna Maria. Et ce jour-là, je me rappelle, une fois, j'ai craqué. J'ai dit, j'arrête tout et j'en ai marre, je préfère me donner la mort. Tout le monde a revu. Tout l'hôpital est sorti. On est resté avec moi jusqu'à 16 heures pour me moraliser, pour m'écouter, pour demander pourquoi et pourquoi. On a continué à me suivre jour par jour, mois par mois, jusqu'au point là où je suis revenue indétectable. Et ce jour-là, c'était une fête pour moi parce que ça m'a redonné la joie. Par la suite, maintenant, je suis restée jusqu'à présent dans ma ligne. J'ai respecté ma ligne et depuis lors, je suis toujours dodue, belle et bien portante, telle que je suis actuellement. J'ai connu beaucoup d'espérances, des hauts et des bas. Et dans l'ensemble de tout, ce que j'ai pu retenir comme leçon, c'est qu'il faut s'accepter tel qu'on est, qu'on s'accepte soi-même et que quand on prend bien son médicament, on peut vivre le plus longtemps possible.
"15 licensees can supply adult DTG products and 14 licensees can supply DTG pediatric formulations. TLD, DTG 50 milligrams, DTG 10 milligrams for infants, and other formulations, and now pediatric ALD.
My name is Sister Teresa. We are at Nyumbani in Karen, Nairobi. Nyumbani means home, and this home started by late Father Angelo D'Agostino in 1992 to take care of HIV positive orphans, either orphan or abandoned children. And from that time, we are here and we are known for HIV care.
Good girl. Good girl. Come smile.
When Father Dag started this home, these children lost their families and their parents. So there is nowhere they can call home. So that was his idea. So they will have a family there, family atmosphere, and they can call mom, and this is my house or home. House moms are trained to take care of the children as well as with the medications and all. And they know their responsibilities, also safeguarding the rights of the children So they stay with the children and guide them as their own parents. That is what we are doing, and we are proud of it because it is working very well. In 2004, the PEPFAR started providing ARVs free of charge. We were so happy because our children, we could put all of them. Earlier we tried so much because we saw so many deaths. Around 60 of them I have seen myself here in Numbani. The number of pills, it was terrible for a child to take. I have seen up to 9 big tablets, and it was not easy for a child to swallow all those tablets. It was very hard. The little ones were struggling to take that syrup, and it was very hard for them. It was bitter, but we were forcing them, and they are kids, they are not adults. So it was very easy for the children to take this dolutegravir.
The medicine first.
And we appreciate the initiative of MPP.
For a little bit to get mixed properly so that when now is ready, we want to give him now. Okay, Emmanuel, you don't laugh. Okay, take this one. You want water? A little bit of water? Utatoka kwa nini mbaya? Kunywa kidogo. Sawa. That's enough. Really is happy taking that when you are taking your photo.
So those kids, when we see this kind of single molecule, that one is very easy for the children to take med. And they are also happy. They have forgotten about all those so many pills taking, and they are very happy.
DTG and TLD have been supplied in 128 countries. That includes 95 countries for pediatric DTG.
It's for real that HIV is alive. So as to any other families who have got the breadwinners who are taking medicines, it's not about that person being able to live. It's about that person being able to live, and so that the others who need that person are able to be there with the person. They have saved those who depend on me. It has prompted me to know more and be able to educate the community so that they become curious. Because one day there will be no farmer to develop those things. And also to educate our communities, especially because we do want pharmaceutical companies in Africa. And we are aware that Africa is Africa. I'm now 26th year living with HIV. I've turned 50 this year. I am still in first line. I don't want to go to second line if I'll ever have to. Taking lots of meds. At first, it was not easy for people to switch from their old fixed dose combination to the new TLD. I've got a very close friend of mine. She is very lazy with swapping medicines, because for her, even accepting HIV has taken her quite some time. And now she doesn't see herself changing medicines because she thinks that, no, it's better the devil I know. So she called me and said, like, I'm like a zombie. It makes me feel happy and better because I know the complexes around taking medicines that has got lots of side effects. And I guess that's why many people got tired of taking medicines. I am very happy that I am able to sleep because I want to sleep. Not to sleep because the medicine that I'm taking is pushing me to bed. I am happy that I'm able to grab a book and read without thinking that this medicine will make me not finish this book. So now a person is able to go to work. So it's well received in our countries. It makes life easy. With the assistance of Medicines Patent Pool and their work of assuring that the medicines are available for many people is needed more than they are doing. They are pushing so far. And without more pressure from the civil society, they will not be able to do it alone. I know it's not an easy task at all. So it needs really people to sit down and think again that we created these pills to save people's lives. So let it go where it's needed.
1 billion packs of DTG supplied in low-middle-income countries. 1 milliard de boîtes de médicaments à base de DTG distribuées dans les pays à revenus faibles et intermédiaires. Around 24 million people take DTG on a daily basis in licensed countries. Affordable, adapted, quality medicines for all.